Hi, my name is Nahlee Gordon, and this is my healthcare system comparison project. So, the country I selected for my project was Norway. And why did I choose this country and what interested me about it? I chose this country because after doing research, it seems like a very safe and stable society for individuals. And what interested me about this country is the beautiful sights it has outdoors. How much does your chosen country spend per capita on healthcare compared to the US? What does that tell us about healthcare costs in your country? So, according to Commonwealth Fund, Norway per capita spends about $6,647 on healthcare, while the US spends $10,637 on healthcare. And I believe that this tells us that Norway has better policies when it comes to healthcare. For example, Norway has always had urgent care running with a lot of beds to make it a cheaper option for patients before the hospital. So, what is the life expectancy in your country compared to the US? And what does this indicator tell us about healthcare quality in your country? So, Commonwealth tells us that the life expectancy in Norway it's going to be about 82 and a half years old, while in the US it is 79. And this indicator tells us that healthcare quality in Norway is better than the US because it goes based on just like income and even like a diet can play a role. So, how does your country compare to the US when it comes to coverage, access? What percentage of people have some type of coverage? So, in Norway, high quality healthcare that is affordable or cheap, while in the US it's more profit driven. And the medication is going to be more expensive, the products are going to be more expensive. So, this causes the US to deal with a lot more shortages and things like that, which makes it very much more expensive. And so in Norway, there's only about 9% of individuals who have some form of private coverage, while in the United States, about 92% of individuals have that form of private coverage. So, how does your country compare to the US when it comes to choice? How much choice do patients have in where they go for care or who they see for care? So, Common Health states that, hold on. So, Common Care tells us that care in Norway, they have urgent cares, primary cares, and they also have emergency services and clinical decision units. So that clinical decision unit, it's going to be basically where you see a physician and they assess you and they're going to tell you like what the best plan for you is going to be, or if your situation even means you need to go to the emergency room, or maybe it requires you to just go to the urgent care because it's just something like minor and doesn't need like ER treatment. And like as for the US, we mainly only have emergency rooms, urgent cares, and we also have like employee mental health things, which is like if you're an employee for a certain company, they do provide like mental health care. And another thing Commonwealth tells us that in Norway there are more choices for individuals to choose where they go for care and see with more affordable options, while in the US has limited options that are very expensive. And this will cause individuals in the US not to even want to step foot door in like a medical setting because they're like, okay, I am very sick or I do have an emergency, but I can't afford that right now. So, the most interesting thing I learned about Norway is that patients who do have permanent illnesses like cancer or just anything that's very like detrimental, they do receive a tax deduction for that illness. So, what do you think this country does better than the US that we could learn from? What does the US do better than your chosen country? So, personally, what I think Norway does better than the United States is that the healthcare is not a worry for individuals. And the US could learn from this because there's many individuals, who stress about medical care. Like, so a lot of people do go without, and because they can't just afford the bill. And I believe what the US does better is I can say that they put a lot of money towards their health care, even though it's not the best, but they do like put out a lot for the health care. So overall, that was my presentation about Norway.